Botox is used for one of America's favorite cosmetic procedures.
Right here.
Made from the same toxin that causes botulism, it's approved by the FDA to reduce wrinkles. But tonight, the CDC and FDA are investigating botulism-like illnesses from Botox injections given in non-medical settings. The CDC says at least 4 people have been hospitalized. Dr. Pooja Sodha is the director of laser and cosmetic dermatology at George Washington University.
The fact that all these incidents have happened in what they call non-medical settings, does that give us a clue?
I think it supports the notion that when you're operating in a more licensed environment, there is a due diligence that you're getting a product that's manufactured correctly and then being administered correctly.
NBC News identified 12 confirmed or suspected cases of botulism-like illnesses in 5 states. Illinois and Tennessee health departments say their cases may involve counterfeit Botox. Symptoms include blurred and double vision, droopy face, and shortness of breath, all similar to botulism.
As a patient, how do I know if I'm getting counterfeit Botox or the real thing?
I don't think as a patient you'll be able to know.
The CDC says these cases are rare. Patients should do their homework, talk to providers, and make sure they are licensed and trained in the art and science of Botox. Anne Thompson, NBC News.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.